Now, Executive Suite with WPRI.com reporter Ted Nisi.
Welcome to Executive Suite. I'm Ted Nisi. Always good to have you with us. This week we are talking about Rhode Island's health insurance exchange, whether you call it the Affordable Care Act or Obamacare. It's the marketplace that was set up in Rhode Island, in the state, to help people get insurance as that law rolls out. Obviously been in the news a lot. There's controversies around it, and there's a new executive director, Anya Rader Wallack, and she is my guest today, the new executive director of HealthSource RI, Anya Rader Wallack. Thanks for being with me.
Thank you for having me.
So, ton of different things we can talk about. Welcome to Rhode Island, first of all.
Thanks. I've lived here for 15 years, a little over 15 years.
Working
now.
In the state government has to be different from living here.
Yeah, this is a little different. I'm getting fully immersed.
A new world for you, yeah. So there's much more I want to talk about than just the budget for HealthSource, which is what's been in the headlines a lot. But I do want to start there. Even before we get there, can you give people a sense of how big an enterprise HealthSource RI is right now? After you're up and running, people are enrolling. How many people enrolled? How many people work there? What's the sort of thumbnail sketch of it?
Sure. So we currently have about 35,000 customers who have enrolled in commercial health insurance plans through us. But we actually serve a much bigger customer base than that. If you look at the total numbers of people who have sort of gone through our system, used our front door is one way I like to talk about it. There's the 35,000 who came through and enrolled in what we call qualified health plans, which is commercial health insurance.
That's Blue Cross, United, Neighborhood.
Yep, those three are the carriers. And we connected them when they were eligible with a federal tax credit that made their coverage more affordable. But another almost 200,000 Rhode Islanders came through and were determined eligible at some point over the last couple of years for Medicaid. So we're also a major front door for the Medicaid program. So we serve both sides as a front door, and then actually enroll people who are eligible for the tax credits in coverage, and try to connect them with those tax credits to make it more affordable. In terms of the size of the organization, we currently have about 15 staff. We have a lot of consultants who've been working for us over the last couple of years, building the technology that undergirds our whole system, doing things like outreach, marketing, setting up our data and analytics. We are in a mode now where, as we get to the point where the federal government stops paying our bills and requires us to be so-called self-sustaining, we have to ramp down on our expenditures. So we're really very much in contraction mode. We are weaning ourselves off of contractors. We are doing a lot of work to make sure that the technology that we've been working on over the last couple of years is finished and works to the best extent possible. And we will be going from a current expenditure level in this fiscal year of about $50 million to $30 million in the next fiscal year, if the legislature approves that, down to a level of about $11 million in the following year. So
big drop because you're going from a build out to a sustaining.
Exactly. I mean, the way the federal terms are design, development, and implementation. So you're doing a startup, you're building this big operation, and then you maintain it. And a lot of the activity and personnel that we've had around in the first couple of years were aimed at bringing people through the door, making them familiar with this as a mechanism for getting insurance and a mechanism for getting the tax credits. And in the future, hopefully, we have that name recognition. People understand what we are, why we're here, and so we can spend a lot less on that and have somewhat fewer people on the ground, and make better use of the resources that we have in Rhode Island.
And as you know, the big debate at the State House is whether you should continue to exist. Not to put too fine a point on it, there are lawmakers who've suggested that Rhode Island should wind down HealthSource RI, shut it down, and switch to that federal healthcare.gov site, which a lot of states are using. We're expecting the budget to come out soon. Have you gotten any indication on whether they're going to give you the funding you've asked for, or if it will be shut down?
I don't know for sure, but we've been having productive discussions with the legislative leadership. The governor, as you know, introduced a budget article in March proposing both a reduced budget level for the upcoming fiscal year and making some pledges about the out years and the budget level that we would run at. And she also proposed a funding source We've had hearings on both sides of the legislature about the funding source, and have been working with leadership and staff to sort of massage that proposal. At this point, I'm optimistic. I have to be optimistic. But we think we've done a good job of making the case that when you look at all the facts, it makes sense to keep this in Rhode Island, because we have to pay for it either way. I think at the outset of the legislative session that may not have been well understood, that whether you have a state-based exchange or the federal exchange, either way there's an assessment that falls to Rhode Island ratepayers. And when you look at the magnitude of the assessment in both scenarios and the benefits that we derive by having a state-based exchange in terms of influence on policy, local jobs, local customer service, we really think it makes sense to keep it here.
Now, that funding stream the governor's proposed, it's an annual assessment. I'm not going to get into the complicated math. We do have a story on our website breaking down how the calculation works. But in short, 1 to 4% assessment on small group health plans and individual ones, whether you buy it on the exchange or not.
Right.
Not necessarily a popular idea. There was a poll, 63% of Rhode opposed that proposal. You know, to the average person, why should people not using HealthSource RI have to pay to fund HealthSource RI?
So the assessment needs to be spread across the entirety of the small group and individual market, inside and outside the exchange, under either a federal assessment or a state-based assessment.
That's federal law.
Under federal law, it's considered one risk pool. The prices have to be the same inside and outside the exchange, and therefore anything you add to the price in terms of a premium assessment has to be spread across the entirety of the market. You could do a user fee just inside the exchange. Some states have done that, but they've generally combined that with a assessment that goes into the premium. The advantage of using the premium assessment is that for people who are below 400% of poverty, who are purchasing individual policies through the exchange, if they are eligible for a federal tax credit. And essentially what that federal tax credit does is put a ceiling on the amount of their income that can go to paying for health insurance. So at a max, it's 9.5%, I believe, that you can pay towards your health insurance. So if we put a tax on top or an assessment on top of the premium, that gets absorbed by the federal tax credit for anybody who's getting that tax credit. So we thought that was the best way to maximize the federal funding, lessen the burden to individual Rhode Islanders, and we shifted, in fact, the assessment in our proposal, we shifted it more toward the individual side and away from business, so we could keep the burden as low as possible on business and, to the greatest extent possible, take advantage of the federal funding on the individual side. All
right, we're going to take a break. When we come back, we're going to talk much more with HealthSource RI Executive Director Anya Rader Wallack about what the organization has been doing since she took over with the new governor's arrival and what the plans are for the future. Stick with us on Executive Suite. Welcome back to Executive Suite. I'm Ted Nisi, and we are talking today with Anya Rader Wallack. She's the new Executive Director of HealthSource RI, which is the Affordable Care Act, Obamacare marketplace Rhode Island set up to implement that law and help people get health insurance, et cetera. I want to ask just a little more about the budget before we move on. You said you're looking at once the budget is shrank, about $11 million. Is that where you expect it to stay in the years after that, you know, with inflation or whatnot?
So that's the commitment that we've made for fiscal year 17, because the challenge that the governor gave me when I took the job was make this cost no more than it would cost if we were to switch to the federal exchange. So in terms of the amount of money that would be assessed on Rhode Islanders and the transition costs that we would pay as a state to transition to the federal exchange, add that up, bring me a budget that comes in under that. So that's what we did. In the out years, she has asked me to just bring in a budget that is comparable to the federal exchange. So what that amount is could vary. The feds currently, as I said, have an assessment on carriers. They have the ability to raise that in the future. But our commitment is to make sure that we stay below whatever that level would be in the future.
Will Rhode Island, if Rhode Island were to go to the federal marketplace, I know you're optimistic it won't happen, but if it happens, have the Fed said how much they spent, I don't know, well over $100 million to build HealthSource RI, the federal government sent. How much of that would Rhode Island have to give back to them?
They've told us they would not so-called claw it back. They would let us leave with having spent their money. So that is good news if that was an eventuality. That was an outstanding question. The Finance Committee asked me about that, so I asked the feds, and they said no, they do not intend to claw back those funds.
Interesting. Okay. House Speaker Mattiello told the Chamber of Commerce recently HealthSource wasn't working as well as we'd been led to believe last year when it was getting good press and everything. And you've acknowledged when you took over, you said you found problems at the agency. What sort of problems did you see when you took over in, I guess, January around there?
Yeah. So if you look at kind of the guts of our operation, it's an enrollment and eligibility machine. So people come through that front door I talked about, and they are, we take information about their income, about their family size, yada, 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 and we figure out what they're eligible for in terms of a federal tax credit. And then we help them through the process of choosing a health plan. And then they get connected with that health plan, and data has to flow from our system to the carrier who they've chosen about how much needs to, what plan they've signed up for. Ultimately, several data systems have to keep track of how much does the customer owe, how much does the federal government owe, what kind of coverage do people have, does that change throughout the year? And what I found when I came in was the system that had been built to date was producing many more errors in terms of the data that resulted, so that people were losing their coverage when they shouldn't have, getting billed the wrong amount, experiencing various kinds of glitches in their accounts. And so what I've been working really hard on since I came is, number one, when those problems occur, how do we deal with them? And how do the people who work at our contact center, which is sort of our frontline customer service, how do they deal with those situations and make sure that we resolve the problem, give the customers reasonable expectations about when the problem is going to be resolved, and get through to resolution as quickly as possible. So we've shifted a lot of resources to what we call escalations, which is those cases where there are those problems. We, over the long run, have to make sure that we just aren't producing that many problems out of our system. But in the short run, what we've done is shifted a lot of resources to take care of those customers who are in those situations. And then second, make sure we fix the system. So every month we have what we call releases, software fixes that go into the system through our contractor. And month by month, we are working on actually fixing the root cause of whatever the problems are, and adding functionality as we go along, so that to the extent that problems have to be fixed, it's much easier to do that. So it's an ongoing process. I think we're doing much better now than when I came through the door, but I wouldn't claim that there are no customers who, that there aren't customers who are experiencing problems. I think it still happens, but hopefully we're dealing with it better. And with every month that goes by, hopefully we're reducing those or eliminating those root causes so that customers won't experience that.
It's obviously a business show, and I know one of the selling points you've given for HealthSource RI is that employers who use it to purchase their coverage can have their employees choose between different plans, which is not, the federal government doesn't do that. You want to see enrollment jump from about 3,000 this year to 10,000 employees of small businesses. How are you going to get there?
I think we have a great product to offer to small businesses. And as somebody who was a small businesswoman myself prior to taking this job, I had a very small consulting firm in Fall River and had a couple of employees. And I know as a small business person that even one who's very familiar with health insurance, have a 25-year career in this business, it was a nightmare to choose. It's a nightmare because it costs so much and because the costs go up so much year to year, but it's also a nightmare in terms of the way you shop for insurance and the lack of sort of apples to apples comparisons. And so I think what we offer as HSRI to small businesses is really two things. One is ease, and the other is choice. So in terms of ease, we try to make it as easy as possible for employers who come to us for their coverage. We have a team called the Business Engagement Team that really handholds employers and their employees through the process, helps them understand their choices, provides quotes, and then once people sign up for coverage, we make it so that as an employer you get a single bill. Your whole administrative process around getting health insurance is much easier than it would otherwise be. And we also offer, as you mentioned, what we call the full employee choice model, which means if you're an employer and say you have 10 employees, normally you would have to choose among that kind of indecipherable range of plans, but you'd have to choose one for all your employees. We allow you to come in and choose up to 20 plans, and individual employees can choose a different plan. So you as an employer can either say, I'm going to pay for the amount associated with this plan, or I'm going to pay a flat dollar amount. And your employees then get to buy up or down. And it's extremely popular. 85% of the employees who are enrolled through that side of our business, which we call the shop side, are in the full choice model. And I think it's really, it's a very attractive model for making sure that employers stay in the insurance game but are able to tailor better to their workforce.
And when it comes to employers, when is the number going to rise on, right now it's capped, how many employees you can have and use HealthSource RI? Is that going to change?
Yeah, right now it's 50 and under, so businesses with 50 or fewer employees can come in. Starting next year, it will be up to 100.
Oh, okay. So more people, and you're going to, I assume, reach out and try to get those people to sign up.
So to answer your question, that's one of our growth markets, is to be able to cater to those larger businesses where, again, they may have more capacity to deal with the administrative burden associated with insurance. But that choice model, I think, will be very important for employers who have a very diverse workforce, and some might be young and they're, they want to keep more money in their pocket and buy less insurance. Others might have more healthcare needs, and so they want to have more coverage. All
right, we're going to take another break. When we come back, we're going to talk more with HealthSource RI Executive Director Anya Rader Wallack about the future of the agency if it keeps existing. Stick with us on Executive Suite. Welcome back to Executive Suite. I'm Ted Nisi, and we're talking this week with Anya Rader Wallack. She is the Executive Director of HealthSource RI. Anya, I wanted to ask you, we were talking about expanding who uses HealthSource RI, those efforts. What's going on with discussions about getting state and local government to have their employees use this, government-sponsored health insurance exchange?
So we're in the very early stages of that, but I also think that that is fertile ground for us, and we're very interested in exploring what we could do with state and municipal employees. We can't, as I said in the last segment, we will be able to cater to businesses with up to 100 employees or groups with up to 100 employees starting next year. Very large groups can't come into our business until at least a year later. And it may require a waiver, which is available under the Affordable Care Act to do that. So we're right now exploring sort of what are the legal avenues for bringing in larger groups like the state employees. And then what are the operational and logistical issues, and what kind of stakeholder work would we have to do with the state employees or municipal employees, with legislative leadership, et cetera. So just starting all of that, but if you think of it conceptually, that choice model that I talked about, I think could be very attractive to state employees, in the sense that what we currently do with state employees is provide a very high level of coverage for all state employees. And to the average state employee, what that means is you're giving up a lot of salary for your health insurance benefits, because the union has bargained for that level of benefit, and it's been important. But given the choice, if individual employees had the choice of staying at that level or having more cash in their pocket, I think some would like to probably have the cash in their pocket. So it could be a great way of giving more flexibility to individual state employees, and hopefully providing more predictability about the cost trend for the state over the long run.
There's a very interesting article in The Hill the other day down in Washington said, quote, a number of states are quietly considering merging their healthcare exchanges under Obamacare amid big questions about cost of viability. And it went on to say you've had discussions with Connecticut's marketplace. Mm-hmm. What have you been discussing? So
it's actually been broader than that. There's a consortium of all the state-based exchanges that gets together on a periodic basis and mostly gives each other therapy, but we also have business discussions, and recently we got into the territory of, as we all move towards sustainability and have to really make sure that our operations are as efficient as possible, what could we do to work together and share services, potentially contract together? What are the ways in which we could achieve some efficiencies? We have talked with Connecticut about the potential for doing that with them, because they're one of the states that's really interested in this. We're very early in the process of talking with them. I don't see any sort of giant obvious fronts on which we could collaborate, but I do think there are some things that we could do together. And we will certainly look at that with any kind of contract expiration or the need to go out to procure for anything new. I think we will definitely incorporate, can we do this with one or more other states, into our thinking and evaluate whether that's an opportunity for savings.
Major Supreme Court case we're waiting for. We're taping this in May 2015. Expected to be decided in the coming weeks. King v. Burwell. It'll determine whether the federal marketplace can continue to offer subsidies to people who buy their insurance through that. Most states, as we said, aren't in state-based ones like HealthSource RI. You wouldn't be directly affected because you're a state-based exchange, but are you concerned about the impact if the Obama administration loses that case?
Well, I think it's going to be chaotic. And so I worry mostly about consumers in other states that don't have state-based exchanges, how the rug is basically going to be pulled out from under them. We've got 35,000 Rhode Islanders who are depending on those tax credits to make their coverage affordable. Many of them are at very low incomes, just above Medicaid eligibility levels. And if you took away that subsidy, that tax credit, there's no way they could continue to pay that premium. And so that kind of market disruption, I don't take lightly. And then I think it will sort of be a distraction for the federal government, and they're a strong partner of ours in this adventure, so I don't look forward to that. But mostly we're safe in Rhode Island in the sense that the tax credits would continue to flow to us even if the case went against the government. But I'd hate to see what it'll do in other states.
We only have about a minute left. I'm just curious, you came into a situation where there wasn't necessarily strong support yet for an agency you were taking over. How difficult has this job been since you took it? Why'd you decide to take it?
It has been challenging. I decided to take it because I have lived in Rhode Island for 15 years, but have largely worked out of state. In other states doing consulting and working in state government, and in Vermont commuting from Rhode Island. And I saw the opportunity of a new governor coming in and having an aggressive agenda for keeping HealthSource here, knowing that it was sort of a job half done and that somebody needed to see it over the finish line and would be a challenge and is one of the most interesting challenges right now in state-based health policy, which has been my entire career. So yes, it's challenging, but it's a place where I think it's a good use of my talents, and it's an exciting time to be involved, even though it is challenging.
And we'll see if you keep existing. All right, that's the challenge. So thank you so much for being with us. That's all the time we have. Anya Rader Wallack, she's Executive Director of HealthSource RI. Thank you for joining us this week and every week on Executive Suite. Remember, if you miss any episode of the show, you can always catch those on WPRI.com, and you can now catch us on the radio Sunday nights at 6 on AM 630 and 99.7 FM. See you back here next week on Executive Suite.